Good afternoon, everybody. At the outset, I'd like to thank Dr. Millie, Dr. Jignasa, and the entire OFI team, not just for arranging this conference, but for all the wonderful work that they do, for all the inspiration and guidance that they provide, and for all the people whose lives they touch, including myself, as I will show you. So, I'm primarily a neurosurgeon, and though my topic I was asked to speak on ozone in autism and neurodevelopmental disorders. I'm going to talk about how did I get there? I'm a neurosurgeon. I specialize in regenerative medicine. How did ozone come into my life? So basically, I'll be talking a little bit about ozone therapy in COVID, my own personal experience, how we used it as a preventive treatment for healthcare workers, a clinical trial we did, and another non-randomized control study. Then we'll talk a little bit about anti-aging, and then the main topic, which is autism and neurodevelopmental disorders. So, ozone in COVID. In COVID, uh, I was professor and head of neurosurgery at the medical college, and we did a clinical trial on stem cells in COVID 19. And to do this clinical trial, I had to be in the ICU in the middle of a whole lot of very serious patients. Also, this is our hospital, this is the NeuroGen Brain and Spine Institute. And for the COVID period, this had been converted into a dedicated COVID hospital with 75 patients. Now imagine having to deal with 75 patients in one hospital, see them every day, and then also do this clinical trial. And at that time, I realized it's impossible to not be exposed. So the one thing that I had to do was to protect myself internally so that it didn't make a difference. There is no way you see 75 to 100 patients every day and don't get exposed. And so this was my personal experience. That's me with Jignasa and Miliji. I used to have Miliji on my left side, Jignasa on my right side, getting major and minor auto. This, my dear friends, kept me alive. This actually kept me alive. For the amount of exposure I had to COVID, the fact that I got away without any major illness is because I took on a weekly basis, sometimes 15-day basis. I had my blood extracted, ozone was put, okay, and this really seriously helped me keep going because I used to work even without PPE. I'd stop wearing PPE. I should just wear a mask, okay, and still I didn't fall ill primarily because of this. So this was my introduction, my personal introduction, taking major auto during the COVID pandemic. And then once I started, and when our hospital converted to a COVID hospital, we actually did something interesting. So this is a paper you will see. It's intravenous ozone for prophylaxis for healthcare workers. So what did we do? So when our hospital, we were a neurological hospital, it converted to COVID, I gave all the staff an option uh, to take IV ozonoid saline as a prophylaxis because I had taken major auto. 64 said they would do it, 171 did not. Did you understand that? So we have 235 employees. I offered them, we are now becoming a COVID hospital. I have taken protection with ozone. So 64 said they would, 171 said they would not. So that's the dosage, how we would give IV saline. And here are the results. The ones who took ozone, only 4.6% became positive during the course of our being a COVID hospital. And those who did not, it was 14.3. So there was a significant difference between those who took COVID, 4.6, and those who took ozone and those who didn't. Then we broke down this data into red zone, which is the ICU, orange zone, which is the wards, and green zone, which was the administrative area where there were no patients. So in the ICU, those who took ozone, 8.6% of the staff, 8.6% of those became positive, whereas in the ones who did not take ozone, it was 15. The ones in the orange zone was the wards, again 4 versus 20. That's a significant difference. And in the non-clinical area, 0 versus 3.5. So this is among the, I don't know if there's any paper published which looked at ozone as a prophylaxis for healthcare workers, but we did that. And then we did a CTRI registered clinical trial using ozone in moderate COVID patients. And again, this is published as a paper. Here's my suggestion, by the way. You'll see I'm going to be presenting a lot of my result in the form of papers. And here is my request, especially those of you who are younger. Please document your work and publish it. The world will only recognize your work if it is published in peer-reviewed scientific papers. I know so many of you here doing wonderful work, but there is no documentation. So please document and publish. And you'll notice, of course, in all our papers, you will notice our co-author being Millie, and you'll notice Jignasa as well. So we're always there. We always publish together. So anyway, this was a study. We did a clinical study, and we again gave ozonized saline. This is very interesting. We found in all our papers the oxygenation, you can see these values, improved significantly. So excellent oxygenation improvement, and all the inflammatory parameters came down. All of them. You can see whether it's the CRP, the D-dimer, the LDH, the IL-6, everything came down using saline. So we documented our data. We didn't just give ozone. We did the blood investigations, we documented the improvements, and most important, published it in scientific, and these are prestigious journals. These are not, like for this journal, this is an Alzheimer journal. So we published them all in PubMed Index journals. So this was the proof that it worked. And this is then what we did was, prior to the clinical trial, we had 254 patients. We had 300 patients who had the standard treatment for COVID. And then we had 254 patients who got IV ozone plus standard treatment. And we then compared the data. You can see the duration of stay was lesser in the ozone group 8 as compared to the non-ozone. The use of oxygen 4 as compared to 8. The average duration of ICU stay, you'll notice significant difference, 5 versus 8. And among the recovery, 90% good recovery, 76 in the standard, and no mortalities in the ozone group. So that was about the COVID. And then at that time, we had set up a new hospital facility, a dedicated anti-aging hospital, one of the country's first and exclusively dedicated hospitals for anti-aging. And then we decided that we are going to actually use ozone as part of our treatment. So here we don't use ozone only. We use a combination of treatments of which ozone is an integral part. And this has been my message to various, I take these talks at IMA forums, different doctors forums, annual conferences, and I say it works together. We have to use all of these treatments together. So what we do in our anti-aging, we have hyperbaric oxygen, we have ozone, we give IV vitamins, we do hydrocolon therapy, we have a lymphatic drainage system, we have a microcirculation improvement technique, we use light therapy, deep tissue mobilization, acupressure. Then we use various Ayurvedic treatments from Basti, Shirodhara, infrared sauna. We have a ozone sauna as well, different forms of rehab, yoga, diet, etc. So this combination of treatments, and that is how it goes. We have a 1-week program, and you're busy through the whole day. You can see there is from medical consultation, we do blood investigation, ozone, hyperbaric, gut cleansing. So over 1 week, all these treatments happen, of which ozone, 7 sessions, is a part of the treatment program. So I wish to state that ozone, once again I'm repeating it, it's part of an integral program. Now, the good news about anti-aging is that today there is a simple blood test available which actually tells you how your cells are aging. In other words, with a simple blood test today, it can be predicted how long you're going to live, barring your not having an accident, cancer, heart attack, etc. This test is called the telomere test. It's a fascinating test. It's a blood test. Okay, and I'll tell you a little bit more about telomeres. So, so not only can you actually know your cellular age, when you do treatments, you can see what is happening. Like blood sugar. Blood sugar tells you whether you have diabetes or not, and if you take a treatment, you'll get to know whether your diabetes is coming under control. So, in anti-aging, what is happening is there is a lot of understanding about what is happening at the cellular or subcellular level. This is a separate talk all by itself. I can't go into details, but there is everything from nutrient signal dysfunction, DNA dysfunction, a problem with macrophagy, stem cell exhaustion, cell signaling. So all these factors are there. Earlier, anti-aging was about cosmetology. You just made yourself beautiful and pretty, or you lost weight. Today, it shifted to healing at a cellular level, in fact, at a subcellular level. Because if your fundamental cells are healthy, the whole body is going to be healthy and disease free. The human body is not programmed to be ill. In fact, if we have evolved from animals, and in the animal kingdom, you don't have any of the illnesses we have. These illnesses are illnesses we actually take onto ourselves. So understanding this is extremely important. So what are telomeres? So this is a gene, this is a chromosome. We're all familiar with the X chromosome. At the tip of the chromosome is this thing called telomere. When we are born, the telomere is at its maximum size, and as we age, this keeps on decreasing. And when this becomes zero, that is the time the cell is going to die. That's the time you will also not be able to live anymore. So depending on the size of your telomere, you can actually know your cellular age. So when telomeres become shorter in age, you die more quickly. In other words, telomere length is an indication of your biological age. But here's the good news. The good news is our telomeres say that we can live up to a maximum of 120 years. The human body can't live more than 120. But 120 it can. In fact, the oldest lady recorded survived lived for 122 years. So this is the maximum that we can live. Now, it has been shown that people with cancers, many of the terminal diseases, they have shorter telomeres. Now, this is a very interesting study on telomeres, lifestyle and aging. This is a very, very interesting study. This was done by Dean Ornish, and this is published in this paper. What he did was, it's a 5-year study. He basically took two groups of patients, and one group got a plant-based diet, that's a vegetarian diet, 30 minutes of exercise, yoga, meditation, and once a week social support. Just look at this. I want you to see this very carefully. Vegetarian diet, 30-minute exercise, yoga, meditation, and once a week a 60-minute social activity. So he divides them into two groups. This is the intervention. That the control is no lifestyle change. And see what happens to the telomeres. The ones where the intervention has happened, the telomeres actually increase in size. The ones who haven't, they actually decrease. This is the natural decrease. In all of us, our telomeres decrease. Now, I want you to see this. This is a very important slide. Look at this. If you continue with your lifestyle the way it is, your telomeres will become less. 4 simple interventions, and I want to highlight them for their simplicity. A vegetarian diet, exercise, yoga, meditation, and social support reverses it from here to here. But this took 5 years. This is a 5-year study. So here's the anti-aging study I did on myself. This is very interesting, okay. What I did was, I was 60 years old when I did my telomeres, and it showed my telomeres to be 85. I said, oh my God, the end is near. My cells are saying that I'm 85, and I was really frightened. So then I started taking treatment at my own hospital facility, oxygen-based therapies, which is hyperbaric and everything. And after 40 days, my cellular age reduced from 85 to 70. In other words, 40 days of oxygen-based therapies gave me 15 years more of life. This is science, okay. Then I said, okay, this is good. Let me continue with this. So I did more, and subsequently, it actually brought it down to 65, which is not bad, all right. And then I continued a little more, and then I got it to match. So my cellular age and my biological age are now matching. So this is what happened. It was 65 before. I took 40 sessions, brought it to 70, and then again, and then again. And so over a period of 120 days, I could actually control. In other words, aging can be controlled and possibly reversed by simple oxygen-based therapies. There are scientific papers to that effect, and this is me. This is my blood test. All right. And this is again, like I said, we publish everything. So please, I'm going to keep saying this again and again to everybody in this room. If we want the world to accept ozone therapy, hyperbaric therapy, please publish. Please, but to publish, you have to document. So there has to be thorough documentation. Invest in that. Have appoint research officers if you don't have time, but document. So this is a paper that we published where we actually showed the effects of anti-aging therapies on quality of life. This is in the Journal of Science and Research. And this is what we studied, and we found different things like energy levels, memory loss, mood swings, exertional dyspnea, sleep issues, joint pain, cramps, bloating, acidity, appetite, urinary incontinence, skin dryness, laxity. All of them, okay, they improved, and improved in significant amount of patients. So you can see in some it's 100%, some it's 75%, some it's 88%. So this is the improvement after 1 week of treatment. This is not the 80 days which I took. This is 1 week. And the telomere length, you can see, so the average of the patients before was 5.4. It reduced to 5.8 in terms of age. It was 74 before average. It became 70. So all the people who took this 1 year treatment got, from a science point of view, from a cellular point of view, 4 years addition to life. And this is data is a little confusing, but these are different individuals. So you can see the increase in this is each patient, and this is what their age was before, and you can see everyone has had a little increase after the 1 week treatment. And we converted this into a book, which all of you have. Please read it. It's a very simple book. It's a very easy to do. It's very easy to practice. Okay, so please read this book. Now I come to the main topic. I mentioned all that to let you know how I got into this. So first myself, COVID, and then anti-aging. So let's look at autism and other neurodevelopmental disorders. What exactly is autism? So autism is what we call a neurodevelopmental disorder. It's now referred to as a spectrum disorder. And the problems are that of social interaction, communication, and repetitive behavior. The thing that most people don't realize is the massive increase in the incidence of autism. This is a graph from the CDC, Center for Disease Control of the United States of America. It's the most authentic data on autism on the planet. Now look at this. In the year 2000, you can see over here, it was 1 in 150. Now you keep seeing year-wise, and it became 1 in 125, 1 in 110, 1 in 88, 1 in 59. 3 years ago, it was 1 in 54. Now it is 2 years ago, 1 in 44. This year, it is 1 in 36. Now, nothing has changed. And I just want you to imagine that if this continues the way this is continuing, in the next year, this will be something like 1 in 25. And then it will be 1 in 15. And then it will be 1 in 10. And then 1 in 5. And then what? Autism will become the new normal. It's already happening. The man who's changing America, Elon Musk, has autism. He talks about his autism. Recently, Bill Gates gave an interview. He described his autism. He said very clearly as a child he had autism. A lot of these tech geniuses, They all have had some degree of autism or ADHD. These are people who are changing the world. All right. So this is what is happening. Now, it's important to understand this because the world is not ready for being able to treat so many patients. Now, we've done some original research. We were the first to show this is a PET CT scan, and on the PET scan, this is the blue part. So, the blue part is the part which is hypometabolic or damaged, and we were the first to publish a paper. This is the paper in the World Journal of Nuclear Medicine that showed there are parts of the brain which are damaged. So we saw some parts which are damaged, but we also found parts of the brain that work more. That's why kids with autism have genius in them. And we have identified which parts of the brain work more. We also did MRI scans and we found that the bridge, this is all our publications, that the bridge that connects the right and the left side of the brain is also smaller in these kids. So this is our data from that paper. You can see that the corpus callosum is smaller. We've found different things. We found that they have lower vitamin D levels. We have found changes in vitamin B12. We found decreased oxytocin levels, in elevated homocysteine levels. We found a gene mutation. So there's lots of things that we are finding as we are treating these patients. Gut microbiome test, and we are finding an increased incidence of E. coli, Shigella. We are finding fungal infections, them aspergillosis. Basically, this is pointing to is that autism is a mitochondrial disorder. There's a problem with the mitochondria, which is why ozone and hyperbaric oxygen comes into place. So these are the signs of oxidative dysfunction. Uh, Cerebral palsy is another neurodevelopmental condition where the brain is more severely damaged. You can see this is blue. The damage is more severe. It's a hypoxic ischemic injury. And also intellectual disability that earlier was called mental retardation. Now we don't use that word. It's called ID. And these are the traditional treatments available, but these don't take care of the fundamental problem. Now here's the most interesting data. Between 2008 and 2019, we only did stem cell therapy with rehab. But after our experience with COVID, we added ozone and hyperbaric oxygen to our treatment protocol. And I want to show you the difference between the results of these two. So how do we do this treatment? Basically, we do a bone marrow aspiration, separate the mononuclear cells, and then inject it behind. So a bone marrow aspiration under local anesthesia, separating in the lab, and through a lumbar puncture, we inject it inside. Okay, that's all. So these are the publications. The world's first publication was actually by us. It came from India. The second from China, Italy, the United States. So it's a matter of pride. You know, when I say the world's first paper, I never say it's published by us. I say it's published from India. And it is really, because this is something nobody can take away from you. There's only one, the first person to climb Mount Everest, the first person to land on the moon, and the world's first paper on cell therapy in autism. We published this is our data. So 91% of our patients showed improvement in all these symptoms. Another paper was published in 2020 in a very prestigious journal, the American Journal of Stem Cells. This was a larger sample, 254 patients. And again, we saw that various symptoms from social interaction, eye contact, attention, stereotypical behavior, aggressive behavior. So all these symptoms, they improved. On the scales, the Indian scale for autism and the CAR scale, that also showed statistically significant improvement. Here's something interesting. We found that the improvement is age dependent. So below 5 years, we had a 97.7% success rate. Between 5 to 10 years, it dropped to 94. From 10 to 15, it became 94 and 91 after 15. So the earlier you treat, the better it is, because when you treat early, you get better results. An objective improvement. So this is on a Siemens PET scan is done on two machines, Siemens and GE. So this is a Siemens machine. You can see the blue is the hypometabolic, the damaged inactive part, and post you can see this damage has improved. You can see. So this is objective proof. We showed the world for the first time that the damage in the kids of brains with autism can be reversed. And this is on a GE machine, again the damage before, and here you can see the damage has improved. So we've got a total of 15 papers in autism, chapters in textbooks as well. In cerebral palsy, it was not the world's first paper, but this was our paper in 2015. And again, various improvements in all the symptoms. in quadriplegic CP, in miscellaneous CP as well. And here is proof, the damage before, and you can see that the damage is gone. So this is objective proof that with cellular therapy, you can improve this damage. Um, okay, we've got again 15 papers on cerebral palsy, chapters in European textbooks, cell therapy. This is chapters written by us. In intellectual disability as well. This is again the world's first paper on cell therapy in intellectual disability, again published by us. And this is a controlled study. So in the blue are patients who took cell therapy and rehab, and you can see the improvement. In orange are the patients who took only rehab. So so you can see everywhere cell therapy and rehab had more improvement than the controls who took only rehab in all the symptoms. And again, this is the damage before, after, 4 papers on intellectual disability. Now, what we did is we added hyperbaric and ozone to our treatment regimen 5 years ago. Now we all know about ozone, so I'm not going to go into the details as to how it is given. What is ozone, we all know in this conference. And there are various papers, these are not our papers, that actually showed it helping in disabled kids. So, yeah, and this is the various mechanisms. So I'm almost done. The pathophysiology of and how it helps. So potential benefits. This is how we use it. We use ear ozone. So you can see there ear ozone. We give rectal ozone, and we do ozone cupping. So this is ozone given through the ear. And how it works, it diffuses through the eardrum. It gets absorbed by the lymphatic and blood circulation. There is a transport in the cranial nerves, and it has anti-inflammatory effects. So this is just a short video to show how it is given. That's, it's very easy, no problem at all. And then we do ozone cupping. This is something which in recent work, see, this is the advantage of this workshop. We weren't doing cupping till 6-7 months ago. When in our workshop identified by Millie and done, you actually told us, you showed us this, and now we've started doing this. So we've actually introduced cupping, and this is the rationale. I'm almost done. You can see they put this little cream, and then they do the cupping. So this is something recent, less than a year ago, learned by us from a workshop organized by OFI, and this helps in their speech. Rectal insufflation. So this we find again very useful. We target and kill the harmful pathogens and rebalance the gut microbiome. Gut cleansing is done. I'm going to run through fast. We combine this with hyperbaric oxygen. So we believe that both work synergistically. And basically, when you breathe oxygen at 1 atmospheric pressure, only the hemoglobin of your RBC carries oxygen. But when you give it under high pressure, the entire plasma is full of oxygen. So we are using HBOT as well. Now, the combination. So we are going to compare. This is the last few slides. Only cell therapy and cell therapy with oxygen-based therapies. So 1,446 patients, 701 only cell therapy, okay, and 732 cell therapy with both. And you can see the difference. 87% of the patients improve with only cell therapy, 91 when we combined it with ozone and hyperbaric. And this is just to show you this. Again, you can see the symptoms: social interaction, eye contact. Everywhere, when you add ozone and hyperbaric, the percentage is more than just cell therapy. And same thing with the scales as well. And all right, this is raw data. Again, the PET CT scans showed that when you combine both, the improvement was better. And this is, again, the outcome of cell therapy in cerebral palsy. That was autism. This is cerebral palsy. So basically, then sometimes people ask, why both? So what HBOT does is it helps in delivery of oxygen. And what ozone does is it enhances the utilization and metabolism. So that's why they work in synergy. So I want to say that they work in synergy. The question of which works more on it, that's not the point. They work together. And this is just to show you that synergy and published data. So my conclusion is that oxygen-based integrative therapies definitely helped in COVID and anti-aging. This is published data that cell therapy helps, but when you add it to HBOT and ozone, the results are still better. I'd like to end with this. We have Prime Minister Narendra Modi, a perfect example of anti-aging. He does yoga. He also is very devoted to special these kids and done a lot of work in that. I'm very fortunate that in a book that I have written, Prime Minister Narendra Modi ji has written an introduction. I don't think he has written an introduction for any other medical doctor. This is a book on muscular dystrophy, a condition very close to his heart. So I have an introduction by him, and that is myself presenting him with a copy of the book. And I'd like to end with a short, this is the last slide, a short video of him talking about this treatment.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that is the Prime Minister of our country talking about the treatment that I just presented. I'd like to thank you for your attention.